Site Principal Investigator at Team RN, Dr. Daniel Osei-Kwame, says over 82% of all cases of severe or moderate injuries are as a result of road accidents, emphasizing that Ghanaian roads remain unsafe to ply.
Once in a while we hear of an accident on the road and the whole Ghana, gets up to talk about it. But we need to go beyond that. Over 82% of all cases of severe injuries or even moderate injuries are as a result of road traffic accidents. That means that for whatever we do, our road is not still safe for us. And that is something we need to take a look at. For all cases of patients coming in with severe injuries from especially from the referral side, a huge amount of them, bordering over 50%, normally die if they come in from a referred place. That means that there's much more that we can do at the referrals as well. These are all things that the world needs to know.
Dr. Daniel Osei-Kwame was speaking at the network's 10th anniversary themed A Decade of Discovery, highlighting team's achievements and breakthroughs in clinical research and healthcare. Since its inception, Team RN has been at the forefront of advancing trauma care through innovative research, education, and networking among healthcare providers. The anniversary event at the Komfonochi Teaching Hospital brought together healthcare professionals, researchers, and community members to reflect on a decade of significant contribution to trauma care and emergency medicine in Ghana. The head of the Research and Development Unit at CAT, Dr. Evans Yeboah, observed most traumas are related to head injuries.
Usually when we do our performance reviews and from some of the research that is coming up, we are seeing a lot of head injuries. It's a major concern for us.
He added that though cases of injuries are on the rise in Ghana, there are inadequate resources to care for patients that are admitted with severe cases.
Our capacity to handle head injuries, spinal injuries and all that is mainly based on neurosurgery specialization. And if you look across the country, we have a very limited resource base for neurosurgery care. And so, whereas we are seeing the numbers increasing, we don't have a lot of people to support the care in that area. So it's an area that we need a lot of preventive interventions, a lot of education to our public, people using tricycles, motorcycles, the using of helmets, seat belts and all these things so that we can prevent these injuries, whilst the nation as a whole builds its capacity in terms of neurosurgery care to handle some of these things.
A significant aspect of the anniversary was the unveiling of a dissemination plan aimed at a weekly or monthly publication of research findings to inform the public about the current statistics of traumas and injuries in Ghana. Reporting for Joy News, Erabna Akwe, Kumasi.